Thank you, Dr. Abhishek. Thank you, Hindi team. Now we are moving to our English session. Today is our 2160th day of continuous webinar. Thank you all the participants for joining with us. And now we'll begin with a silent prayer. Good evening and welcome once again. Today is our 2160th day of continuous webinar. Thank you all the participants for joining with us. Thank you all the faculties for sharing your knowledge with us. And today's our speaker is Dr. PARTHKUMAR V. Dev. He is working as assistant professor in the Rajkot Homeopathic Medical College in the Department of Homeopathic Repertory and Case Taking. And he's successfully running a clinic, Shiv Homeopathic. And I am welcoming Dr. PARTHKUMAR to IFPH webinar. Sir, you're welcome. And we are happy to get you as a speaker of today. Thank you. You can start now. Please unmute yourself and okay.
Am I audible, ma'am?
Yes, yes, audible. I think.
First of all, thank you so much.
Some glare is there.
Glare is there, yeah. You have to switch off some lights in front of your.
Yes.
Because it's no, not that light. I think now also
you may please look at the screen so that you can understand how it looks like, how you look like. There is some shade.
We are seeing some
lines
in front of your image.
It may be due to some network. Oh.
Now also it's there.
No.
It's okay, doctor. What to do? We are seeing some light are running in front of your image. It's okay, no problem.
Maybe.
I think you couldn't find it out, right? What is the disturbance? It's okay.
No problem. You can
carry on. You proceed.
Okay. Am I audible, ma'am?
Yes.
First of all, thank you so much for giving me such an opportunity to share my little knowledge about the diabetes mellitus on such a platform. And thank you for my warm introduction and welcome, ma'am. Okay. First of all, I would like to share that why I select this topic, why diabetes mellitus only. As we all know, diabetes is a silent killer. If we see the epidemiology, in past 3 decades, the prevalence of diabetes mellitus has risen dramatically in all the countries of all income levels. About 830 million people worldwide have diabetes. The majority living in low and middle income countries. The number of people living with diabetes rose from 200 million in 1990 to 830 million in 2022. In 2021, diabetes and kidney disorders due to diabetes caused over 2 million deaths. In addition, around 11% of cardiovascular deaths were caused by high blood glucose. These all the data are taken from International Diabetic Federation, which are periodically publishing all the epidemiological data related to worldwide and country-related spread of diabetes mellitus. Apart from this, according to study which is shown in diabetic retinopathy, which are published in Diabetology and Metabolic Syndrome Journal, diabetic retinopathy affects 17.6% of the studied population. The study involving 66,726 participants, which revealed the following distribution of the complication. There is macrovascular complication nearly about 27.2%, microvascular complication which were observed nearly in 53.5%, and there is 27% which are showing both macrovascular and microvascular complications. The global diabetic epidemic has shown a dramatical increase with cases of surging from 108 million in 1980 to 422 million by 2014. This health crisis has particularly impacted low and middle income nations, which experience faster growth rates which compared to wealthier countries. The period between 2000 and 2019 witnessed a 3% rise in age-adjusted diabetic mortality. Combined diabetes and diabetes-related kidney disorders, which are claimed approximately 2 million lives in 2019. As of 2014, diabetes affected 8.5% of the global adult population, which is aged 15 or above. The condition directly caused 1.5 million deaths in 2019, which nearly half of the diabetes-related fatalities occurring in the people under 17 years old. India faces a especially concerning situation with its diabetic population exceeding 62 million individuals, and projections suggest this number could reach 79.4 million by 2030. One out of every seven people with diabetes mellitus globally is from India. As of 2021, India reported a 99.6% diabetes prevalence rate among adults, which is aged 20 to 79 years old, representing approximately 74.2 million individuals. So that we can assess that India becomes the hub for the diabetes mellitus, and also the Gujarat, our state, is also the hub for the diabetes mellitus. Okay, now we will move towards the history of the diabetes mellitus. Diabetes is taken from the Greek word diabetes, which meaning siphon. Siphon means to pass through, and the Latin word mellitus, which means sweet. A review of the history showed that the term diabetes was firstly used by Apollonius of Memphis around 250 to 3000 before Christ, 300 before Christ. Ancient Greek, Indian, and Egyptian civilization discovered the sweet nature of urine in this condition, and hence the propagation of the word diabetes mellitus came into being. According to history, diabetes was firstly described in Egyptian manuscript 1500 before Christ as too great emptying of the urine. And around 3000 years ago, in Indian Ayurvedic literature, it is classified as honey urine, and we will know mostly as Madhu Prameha or Prameha. Now, WHO's definition about diabetes mellitus. Diabetes is a chronic metabolic disorder which is characterized by elevated level of blood sugar or blood glucose, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. The most common is type 2 diabetes mellitus, which is usually in adults, which occurs when the body becomes resistant to insulin or does not make enough insulin. ICD-11 coding for diabetes mellitus type 2 is 5A11. Diabetes mellitus encompasses a collection of metabolic disorders which are marked by elevated blood glucose levels, while primarily affecting the carbohydrate metabolism. This condition also disrupts lipid metabolic process. Type 2 diabetes, the most prevalent form, is largely associated with several lifestyle factors: excess body weight, high calorie dietary habits, chronic stress, and lack of physical activities. So that we can term that diabetes mellitus is a chronic disorder, metabolic disorder. Also, it is associated with lifestyle, and also it is autoimmune disorder. Type 1 diabetes, which is formerly known as insulin dependent diabetes mellitus or IDDM, is characterized by a complete lack of insulin production, making insulin replacement therapy essential. In contrast, type 2 diabetes, previously called as non-insulin dependent diabetes mellitus, that is NIDDM, is distinguished by the body's continued ability to produce insulin, often at the levels exceeding those found in non-diabetic individuals. The key issue in type 2 diabetes is insulin resistance, where cells don't respond effectively to insulin. Initially, patients can typically manage without insulin therapy. However, approximately one fifth of type 2 diabetes patients eventually develop the insulin deficiencies, necessitating insulin replacement therapy as their condition progresses. Now, what are the key risk factors for diabetes mellitus? First of all, age threshold being 45-year or older. Okay, this data is taken from the textbook of Practice of Medicine Golwara, but this age group is now being much shorter. We can found that 15 to 20 years old students also found suffering from diabetes mellitus. Next, physical conditions, that is excess body weight, high blood pressure, abnormal blood lipid levels, that is dyslipidemia. Next, genetic factors, that is family members with diabetes, that we known as hereditary chain of the diabetes mellitus. Next, medical history, previous diagnosis of impaired glucose tolerance, past gestational diabetes during pregnancy, cardiovascular disease history, and polycystic ovarian syndrome. As we all know, in PCOS, the individual develops the insulin resistance, and that's why the diabetes mellitus type 2 has been developed. Next, lifestyle factors. As we all know, sedentary lifestyle and lack of regular physical activity can lead to diabetes and also the more lifestyle disorders. Next, probable etiologies, genetic factors, genetic defects affecting beta cell functions in pancreas, genetic defects which affect insulin action that can cause diabetes mellitus. Now, diseases which are related with pancreatic conditions such as pancreatitis, pancreatectomy, neoplastic disease, and cystic fibrosis. Hormonal imbalance, excess production of insulin antagonist, which is seen in acromegaly, Cushing syndrome, glucogonoma, and thyrotoxicosis. Other causes are drug-induced, uncommon immune-mediated forms, and genetic syndrome association in association with Down syndrome, Klinefelter syndrome, and Turner syndrome. Now, the most probable clinical features of the diabetes mellitus. In initial presentation, adults are typically experience gradual onset and children often shows the acute onset. Now, commonest symptoms, which are firstly classified in classical osmotic symptoms, which we all know that polyuria, polyphagia, and polydipsia, that is excessive urination, increased hunger, and excessive thirst. Now, general symptoms. General symptoms include unexplained weight reduction, persistent tiredness and weakness, visual disturbances. The next will be the genital symptoms. The genital symptoms include in women vulvar itching and in men inflammation of glans penis, that is known as balanitis. And apart from this, there will be some sexual health issues, that is the decreased sexual drive and male erectile dysfunctions, male erectile problems. Now, probable investigation which are needed during diabetes mellitus. First of all, the blood glucose. The normal blood glucose values, standard range is 70 to 100 mg per dl. This all data is taken from also Golwala and Davidson. Testing methods, random blood glucose. Normal less than 140 mg per dl. Diabetes indicated greater than 200 mg per dl. Now, in case of fasting blood sugar, that is after 12 hours of fast, normal fasting blood sugar will be less than 100 mg per dl, and pre-diabetic will show 101 to 125 mg per dl. Next, postprandial blood sugar, which is taken 2 hours after meal, the normal value could be less than 140 mg per dl. Impaired glucose tolerance will show as 140 to 199 mg per dl, and diabetes indicated greater than 200 mg per dl. Now, OGTT, that is oral glucose tolerance test. Pre-diabetes characterized by impaired glucose tolerance is an asymptomatic condition that may progress to type 2 diabetes mellitus if left unmanaged. Now, what is the procedure for oral glucose tolerance test? Initial blood sample is collected after 8 hours of overnight fast. Then patient consumes glucose solution, which is 1 gram per kg of body weight of patient. Then blood samples are collected at the different time intervals of 30 minutes, 60 minutes, 120 minutes, and 180 minutes. And after that, the blood sugar at different time intervals has been measured. Individuals with impaired glucose tolerance show significantly elevated blood glucose level at 180 minutes mark. In urine analysis, normal daily urinary glucose excretion is 100 mg per dl. Detection methods are Benedict's test, Clinic's test, other reducing sugar test. Now, the most authentic test for diabetes mellitus type 2 is HbA1c. This blood test serves as an important indicator of long-term blood sugar management. The measurement provides insight into a person's average blood glucose levels spanning the previous 2 to 3 months. This occurs because glucose attaches to the hemoglobin molecules in red blood cells, which have a lifespan of approximately 120 days. This report is known as glycosylated hemoglobin reports. The HbA1c levels combined with mean blood glucose. This table shows which HbA1c level is compared with mean blood glucose level of which kind. Now the probable complications of diabetes mellitus. The general complications: recurring bacterial and fungal skin infections, delayed wound healing, impaired hearing, sleep apnea, cognitive decline that shows as dementia, and diabetic ketoacidosis, which is most common in cases of diabetes mellitus. Now the macrovascular and microvascular complication. First of all, the macrovascular complications are myocardial infarction, stroke, ischemia, claudications, and microvascular complications are, as we all know, diabetic neuropathy, diabetic retinopathy, and diabetic nephropathy, autonomic nervous system dysfunction, development of ulcers, and also the joint pain or arthropathies. Now the homeopathic management for diabetes mellitus. The core principles of homeopathic treatment rests on three fundamental pillars, which are collectively known as the homeopath's trinity: case history documentation, that is knowledge of disease; remedy selection, that is knowledge of medicine; and remedy administration, that is application of medicinal knowledge into the disease knowledge. According to the Organon of Medicine's aphorism number 12, the origin of disease can be traced solely to disturbances in the vital force. These three essential components form the foundation of successful homeopathic practice and patient care. Now, the important medicines for diabetes mellitus, which are written in our Materia Medicas, these are the therapeutic indication of some important medicine. Many practitioners give the therapeutic prescription in the diabetes mellitus, but what I found in my practice is the constitutional medicine, which is given according to the history of the patient, gives more longer and more curative effect than the therapeutic ones. So please try to give the constitutional medicine to the patient. Now moving towards the indications. First of all, the Abroma augusta. Abroma augusta has frequent urination during day and night, which represent the symptoms of diabetes mellitus, that is polyuria. Frequent urination of large volume every 2 hours. Diabetes mellitus with nearly constant weakness and fatigue during the urination. The patient urges to pass urine urgently and frequently in great quantities, which relieves the bladder and increases the urine flow. Abroma augusta we can give in the mother tincture form or in the low potencies. Now, acetic acid. Acetic acid is the medicine which is given for violent pain and sensation of burning in the chest region and stomach, lassitude or weakness of limbs, emaciation and prostration. Skin is dry, pale, and waxed with edema of feet and legs. In all the medicines which I have demonstrated in the therapeutics, I have highlighted those words which are related with diabetes or which are the complication of the diabetes mellitus, or which shows directly diabetes mellitus in any materia medica. The next medicine is enantherum. The enantherum is for involuntary urination while walking and nocturnal enuresis. The patients of enantherum is having craving for strong liquors, sour drinks, and spices, love for strong odors, unhealthy skins which easily can be suppurated, and these medicine can be used in third potency. The next is argentum metallicum. Argentum metallicum can be indicated in profuse, turbid, and sweetish urine, which is aggravated at night. Sometimes there is a whey like urine. It distresses him at night, has to rise so often, great weakness and emaciation, face pale and sallow, feet and scrotum are edematous and itchy. Pruritus of the scrotum and pruritus vulvar, which are the complication and clinical features of diabetes mellitus as we have discussed above. Fetid taste in mouth, disposition towards gangrene. This medicine can be used in 6 potency or the higher ones, but without frequent repetition. The next medicine, which is the polycrest and most of the practitioners' favorite medicine, that is arsenicum album. Arsenicum album is given in great exhaustion after the slightest exertion. There is a great thirst. Patient drinks much but little at a time. As we all know, small quantity of water at shorter interval. It is mentioned in arsenicum album that it is indicated in cases of diabetic gangrene. It is for burning pains, peripheral neuritis, ulcers on head, paralysis of the lower limbs with atrophy that can be due to the diabetes mellitus. ulcers with the offensive discharges, and also the gangrenous inflammation over the skin, burning, swelling, edema, eruption, dry, rough, scaly, which is worse in cold and scratching, malignant pustules, modalities, aggravation between 12 to 2 am or pm. As mentioned by some stalwarts, arsenicum album can be given in the most advanced and gravest stage of the diabetes mellitus. It also can cure the grave complications of diabetes mellitus too. Next medicine is Asclepius vincedoxicum. It is for impotency and emaciation associated with diabetes mellitus and mostly used in the mother tincture form. Next medicine is belladonna. In belladonna, the urine is more copious than the drink has been taken. Marked symptoms of cerebral irritation with dilated pupils and hyperesthesia of the senses. Lips, mouth, and throat is dry with extreme thirst. Absence of thirst entirely. The next medicine is Berberis vulgaris. Constant urging to urinate with pain in neck of the bladder, urine very slow to flow with the pain in lumbar and renal region, which is ameliorated by rest. Urine is pale yellow in color with a gelatinous sediment, weakness of the sexual organs, bruised, paralyzed sensation in back, and this can be used in mother tincture or sixth potency. Now both the medicines of Calcarea group, that is Calcarea carbonica and Calcarea phosphorica. First of all, Calcarea carb, frequent and profuse micturition, sour, odorless and pungent urine with dribbling of urine after urination, nocturnal enuresis, ravenous appetite, violent excessive thirst for cold water, great desire for eggs and sweets, great tendency to take cold and oversensitiveness to cold. Now let's move towards the Calcarea phosphorica. Calcarea phosphorica, nearly all the materia medicas have mentioned that glycosuria when the lungs are implicated, diabetes mellitus where lung is having some complaint, and also in various repertories it is mentioned that diabetes mellitus lung complaints with there is a single remedy. Calcarea phos is mentioned as a single remedy rubric. Diminishing the quantity of the urine and lowering the specific gravity, sore aching pain in bladder, aggravation after urinating. Now, diminishing the quantity of urine and lowering its specific gravity. The specific gravity has mentioned the greatest role in the diagnosis of the diabetes. The specific gravity, if it is high, then it shows the diabetes mellitus, and if the specific gravity becomes low, then it suggests diabetes insipidus. In the Kent repertory, we can find both the rubrics specific gravity increased and specific gravity decreased for particularly that we can apply into the diabetes mellitus. As in diabetes mellitus, the sugar is running into the urine so that the specific gravity becomes increased. And in case of diabetes insipidus, there is a great flow of water so that the specific gravity is lowering or decreasing. Next medicine is Carlsbad aqua. Its main action is upon the liver, but the remedy is indicated in cases of obesity, diabetes, and gout. The next medicine is Cephalendra indica, which is the Indian remedy. This medicine is useful in treating diabetes mellitus as well as diabetes insipidus both. The Cephalendra patient is depressed, anxious, and unwilling to work at all. Bloating, which is aggravated after urination, extreme dryness of mouth, and intense thirst for huge amounts of water at once. These conditions are aggravated after urinating. Appetite is decreased. Sugar also present in urine. Weakness and tired feeling after urination. Where patient passing a lot of urine at once and having a clear urine. Burning sensation that permeates the entire body, which is ameliorated by the use of cold or anything cool. Mostly this remedy is used in the mother tincture form or lower potencies. The next remedy is curare. It is mentioned in Materia Medica that it is the remedy for diabetes acutissimus, which threatening the life. That means the sudden change, sudden increase in the sugar level, which can threaten the life and which can cause the sudden complications of the diabetes mellitus. Clear and frequent urine with digging, crampy pain in kidneys, shooting in the stomach, dryness of mouth, great emaciation. Sugar in the urine also present. The next Indian remedy is Ficus bengalensis. There have been reports of the therapeutic use of this medicine in the management of diabetes mellitus. It was demonstrated or observed that the bark of the tree is having active ethyl acetate and water-soluble fractions. In a preliminary trial on normal rats, it had demonstrated maximal hypoglycemic activity in just 2 hours after its treatment, mostly used in mother tincture form. The next medicine is Gymnema sylvestris. It is also the exclusive remedy for diabetes mellitus, reduces the amount of sugar in the urine. This remedy enhances the patient's appetite, causes them to put on weight and muscles, and makes them appear healthier. With the help of this medicine, patient can work hard and no longer gets weary as easily with the little efforts. His sexual, physical, and brain faculties have all improved. It helps to prolong the life of those who have diabetes. Every symptom is associated with a scorching sensation throughout, and it is mostly used in mother teacher form. The next remedy is Helonius. There is sensation of weakness. It is indicated in both the cases, diabetes mellitus and diabetes insipidus, and mostly it is used in practice in cases of gestational diabetes or the females who are suffering from diabetes after the delivery. Apart from the diabetes mellitus, there is a symptom in female of pruritus vulva, albuminous phosphatic profuse and clear saccharin present in urine, diabetes, sensation as if a cool wind steaming up calves of the leg, feet feel numb when sitting. Next, all the three remedies of Kali group, Kali Brom, Kali Mure and Kali Phos. Kali Brom is indicated when the great emaciation, pale skin which is cold and dry, pulse is feeble and rapid, constipation, pale, frequent urine with great density which is loaded with sugar, tenderness of the liver. Kali muriaticum is indicated when excessive urine with glycosuria is being observed, itching in the urethra, derangement of the stomach and liver, stools are dry and light colored, pain in kidneys, great weakness and talking during sleep. Next, Kali phosphoricum. Kali phosphoricum is indicated in cases of remedy for nervous weakness along with diabetes mellitus. The breath of the Kali phos patient is having a peculiar hay-like odor, great thirst with voracious appetite, great emaciation, and it is a great medicine for hepatic troubles also. Now the remedy lactic acid. The person is excessively thirsty with flow of copious urine frequently. Sugar is present in urine. Exhausted from little exertion. Rheumatic pain associated with profuse urination. Now if you see the various repertories, you can see one rubric, diabetes mellitus rheumatic complex with diabetes mellitus rheumatism with. In all that rubric, the lactic acid is given 2 mark or 3 mark as a single remedy rubric. Next, lac defloratum. Excessive backache, large quantities of urine voided daily with excessive lassitude and prostration. Remedy for intense throbbing headache, especially in forehead, which is associated with nausea and vomiting. Now, lycopodium. Lycopodium is indicated in the debility in morning specifically. Lycopodium can be given in the complications which are related with the diabetes mellitus, such as male infertility, there is a erectile dysfunction, there is a great lowering in the sperm count, kidney affections, red sand in urine, backache in renal region worse before urination. There is a deep-seated chronic progressive disorders. The patient we can see as a prematurely old patient. In case of extremities, we can see the numbness, also drawing and tearing of the limbs, especially while at rest or night. One foot hot and the other is cold. Sciatica which is worse at right side and cannot lie on the painful side. The next remedy is natrum sulfuricum, which is a particularly predominantly the liver remedy, which present with the diabetes, urine present with loaded with bile, brick dust sediment, excessive secretions. Photophobia can also be observed. Burning in soles, edema of feet, itching between toes, pain in limbs, compels frequent change in position. The next remedy is Nux vomica. It is very good remedy for sedentary lifestyle. As we all know, the diabetes is a lifestyle disorder and can be induced by the sedentary lifestyle. The Nux vomica will be the great remedy for diabetes mellitus. Dyspepsia with great acidity. There is a relation between dyspepsia and diabetes also that we will know later in these slides. Dry cough with constriction of throat, Beckett with numbness, paralytic condition of lower extremities, paretic condition especially after the ineffectual desire to urinate. There is a key symptom which suggests alcoholism with diabetes mellitus. In various repertories, there is a rubric alcoholism, diabetes mellitus with, and all the repertories only showing two remedies. That one remedy is Nux vomica and the another remedy is medorinum for the particular symptom. The next and most frequently indicated remedy in cases of diabetes is phosphoric acid, which is the great for neurogenic glycosuria, ailments from loss of animal fluids, bad effects of grief, anguish, and sorrow. All joints feels as if bruised. Patient is very much sensitive to fresh air. There is lassitude and heaviness with weakness of mind, hair falling, dimness of vision. Patient is excessively thirsty, too much irritation from acids with pressure in the stomach, constipation with hard, difficult stool, shortness of breath. There is a milky urine which can be termed as chyluria with thick urine or the urine like lime water with whitish curds. Urine with stringy bloody lumps or the clear limpid urine containing much sugar. Pain in back and kidneys. There is dull oppressive pain can be observed in the bladder. This remedy is for the great weakness which is associated with diabetes mellitus. There is a rubric in synthesis repertory in chapter generality that weakness diabetes mellitus with the phosphoric acid and arsenic amalgam has given the highest importance in that rubric. The next remedy is phosphorus. Phosphorus, first of all, indicated in cases of mucous membranes and bloods. It irritates, inflames, and degenerates the mucous membrane. It irritates and inflames serous membrane, inflames the spinal cord and nerves, causing paralysis, which produces a picture of destructive metabolism, great nervous debility, emaciation, neuritis, paralytic symptom, and great lowness of spirit. Brain feels tired, specifically in eyes, that shows the microvascular complications of the diabetes mellitus. There is a cataract, sensation as if everything were covered with a mist or a veil or dust or something pulled tightly over the eyes. Black points seem to float before the eyes. Patient sees better by shading eyes with hand, fatigue of the eyes and head even without much use of eyes, green halo about the candlelight, atrophy of the optic nerve, thrombosis of retinal vessels, and degenerative changes in the retinal cells. Degenerative changes where soreness and curved lines are seen in old people, retinal troubles with lights. So, as we can observe, it covers all the microvascular complications which can be occurred due to diabetes mellitus. It is also the remedy for fatty degeneration of the liver. It is also the remedy for pancreatic disorders. Also, it is good remedy for ascending sensory and motor paralysis from ends of the fingers and toes, so that it can cover more over the diabetic neuropathy, diabetic retinopathy, and nephropathy complications. The next remedy is Rush aromatica. The Rus aromatica is useful in cases of disorders of kidneys and urine, which is very much important in cases of diabetes mellitus also. It is the remedy for enuresis, which is basically related with the vesical atony, senile incontinence of urine. It also has an affinity for cystitis and hematuria. Diabetes with patient passing huge amount of urine with low specific gravity. Again, here the low specific gravity that suggests the diabetes insipidus, so that Rus aromatica can be indicated in cases of both diabetes mellitus and diabetes insipidus. The next remedy, Sickle cornutum. The sickle core person is having general lassitude or general weakness, loss of strength with heaviness of limbs, great remedy for gangrene, emaciation, dry and withered skin, furuncles and petechia. There is a fever with the unquenchable thirst, diminished senses, great thirst with dryness of mouth, morbidly increased appetite with pain in the cardiac region. It is a great remedy for constipation and also the flow of increased quantity of watery urine. The next and most favorite remedy of all the homeopaths in cases of diabetes mellitus is Caesium jambolinum. In Caesium, I have taken the reference from two materia medicas. One of them is boric and another one is Murphy's. In boric, it is written that has an immediate effect on increasing the blood sugar. Glycosuria results, a most useful remedy in cases of diabetes mellitus. It is also indicated in cases of old ulcers of skin, diabetic ulcerations. Now, in case of Murphy, cesium is most useful remedy in diabetes mellitus. It is mentioned that no other remedy causes in so much degree the diminution and disappearance of sugar in the urine as the cesium does. The old ulcers of skin, which is probably of diabetic foundation. The keynote or indicated symptoms for diabetes in case of cesium is prickly heat in the upper part of the body, that is small red pimples or the natal rash which itch violently along with diabetes mellitus. Uranium nitricum. Uranium nitricum is the great remedy for glycosuria and increased urine. It is known to produce the nephritis, diabetes, degeneration of liver, high blood pressure and dropsy. Here the cause is clearly has been mentioned that the diabetes is hepatogenic diabetes, that is mentioned in Materia Medica clearly. The remedy for diuresis, incontinence of urine, emaciation and tympanitis, complete impotency with the nocturnal emission, remedy for defects of digestion and assimilation, purulent discharge from the eyelids with ulceration of cheeks due to the acrid discharges, lungs infiltrated with the grey tubercles, shivering during the day and restless at night, somnolence. Also, there are some cerebral complications. Cerebral complications are seen during the diabetes mellitus. For that, the greatest remedies are lecithin and picric acid, which is not mentioned in this list. Okay, these are some therapeutic medicines which can be given according to constitution, which I have taken from the book of Dr. Kamal Kansal, Diabetes Mellitus Basic Facts with Homeopathic Treatment. For leukophlegmatic constitution, we can use calcarea carb or graphitis. Psoric personality, one can use sulfur or graphitis. Psychotic personality, one can use thuja or natrum sulf. For syphilitic ones, one can use kali iode, and the tubercular personality, one can use either phosphorus iodum or tuberculinum. For scrofulous or lymphatic one can use hepar sulf or iodum. Okay. These are not the fixed remedies for such constitution, but we can use these remedies for that particular constitutions. Now the indications of some 12 tissue remedies which is given in the same book. First of all, natrum mure, that can be used in polyuria, excessive thirst and emaciation with loss of sleep, great debility with throbbing headache. Natrum sulf, which is used to correct the pancreatic insufficiency, so that it is one of the best remedy for diabetes mellitus, using in biochemic remedies, useful in people with hydrogenoid constitution. It is a tissue remedy for diabetes. Symptoms are polyuria and pruritus, especially of upper surface of the thighs. In calimure, sugar level high with great emaciation. Califos, remedy for nervous prostration and weakness associated with diabetes and sleepless with voracious appetite. Next, calcareaphos. Calcareaphos is indicated when polyuria and polydipsia is being seen, dryness of the mouth and tongue with excessive thirst, sunken flabby abdomen, glycosuria with lung affections. Next, calcarea sulf and kali sulf for the skin complaints associated with diabetes mellitus. And ferrum phos, diabetes with quick rapid pulse, can be used as an intercurrent in these type of cases. Now there is some views by some stalwarts regarding the therapeutic medicines. Dr. C.H. Bond used the uranium nitricum in some cases of diabetic complication which are related with mental health, that is insanity. Arsenic is ought to play a very important role as a curative and palliative agent in the prolonged and most advanced stages of DM, and it also its grave complications, as we have discussed during the discussion of the arsenicum album. It is for the gravest complication of the diabetes mellitus and also in the most advanced stages of diabetes mellitus. Vipera is useful in advanced cases of diabetes mellitus where there is an ulceration on the skin without the ability to heal itself. Means there is a Vipera can be used in cases of non-healing ulcers. Next, Calcarea phos, which is used in cases of diabetes mellitus with lung complications of great service, not only to the lungs but also in diminishing quantity of urine and lowering its specific gravity. As we have discussed during Calcarea phos too, that in many repertories it is mentioned under the rubric diabetes mellitus lung complaints with there is a single remedy Calcarea phos is being mentioned. Now I would like to demonstrate one case about the diabetes mellitus which I have taken during my dissertation period. A 57-year-old male patient is presented with the complaint of acidity and gas frequently. The patient is suffering from the same complaint since 8 to 9 years. There will be a slight alteration in his regular diet, then he gets the attack of acidity and gas, and there were burning at the epigastric region along with the feeling of regurgitation. Sometimes, due to this gaseous distension, he also got the attack of headache which is ameliorated by vomiting. In morning, while wakening, he do not feel fresh. On the other hand, he is having heaviness of the head with the hangout effect. Before 3 years, he is being diagnosed with the diabetes mellitus. He is also having hypertension since 3.5 years. In family history, mother is also having diabetes mellitus type 2. The patient is married and having addiction of alcohol. Patient is regularly alcoholic and taking tablet metformin 500 mg and tablet telmisartan 40 mg for his disorders. Now, in case of physical journal, appetite and thirst is pretty good. He is having desire for spicy food, intolerance for fatty food. The patient is constipated due to the unsatisfactory stool. The sleep is disturbed and unrefreshing sleeps at night. Dreams are not specific. Thermally, the patient is chilly and which can be assessed by these data. Mental journals. The patient is very much irritable over the trifles, enthusiastic about work and business, dominating in nature, wants everything on time. The slightest mental exertion aggravates the complaint of patient. This is the data from general examination and systemic examination of the patient. The patient has came with the report which is done on 10th December 2023 where HbA1c is showing 10% and the urine sugar is absent. Now there is a belief in the patients that if the sugar in urine is absent, then they will be happy that diabetes is gone from the urine and there is now only present in the blood, but it is not actually there. If the blood is showing such a significant level of the blood sugar and kidney is showing the no level of sugar or urine is showing no level of sugar, then the filters are going to be damaged and the nephropathic changes has been started. So while treating these cases, while seeing the follow-ups of this case, there will be one focus that the urine sugar should be present in the next follow-up so that our remedy can be appropriate. Now, this is the totality of symptoms. Very much irritable over the trifles, enthusiastic about work and business, dominating nature, wants everything on time, slightest mental exertion which aggravates, burning in the epigastrium with the sense of regurgitation, sometimes distension of abdomen, headache due to gaseous disturbances, aggravation, slight change in the diet and spicy food, amelioration by passing stool, amelioration by vomiting. Patient is constipated due to unsatisfactory stool, disturbed and unrefreshing sleeps at late night. This is the repertorial totality which is formed from synthesis repertory and radar software. And this is what the repertorial result is showing. The remedy given to the patient is Nux vomica 200, as we have discussed that. It covers all the symptoms, moreover the symptoms, and also the main key symptoms, that is alcoholism, diabetes, mellitus with. There are only two remedies, Nux vomica and medorinum, but medorinum is not covering other symptoms. So that the Nux vomica is being prescribed to the patient, that is two doses weekly, one dose for 15 days. Now after 15 days, patient has returned with abdominal discomfort slightly relieved. Headache in the morning is still there. No improvement in the weakness. So again the dose is repeated, two doses weekly, one dose, and patient has to call again for 15 days. After next 15 days, intensity of the headache decreases, improvement in the sleep, abdominal heaviness relieved, burning in stomach also reduced, and RBS patient has done that shows 200 milligram per DL. Again, Nux vomica is being repeated 204 doses weekly, one dose, and patient has to call after 1 month. Next, after 1 month and 15 days, sleep totally improved, relief in constipation, no burning in the stomach, craving for alcoholic stimulants also started diminishing. That means the overall relief of the patient is being started. Improvement in weakness. RBS suggests 162 milligram per DL. The patient is being suggested to do HbA1c for the next follow-up, and again the same dose Nux vomica 200 is repeated. After 1 month, constipation relieved, burning in abdomen is relieved, no headache, weakness improved to a marked extent, and HbA1c is 7.4%, which is previously 10%. Patient is still under the treatment. This is the report which is done. First report which is done on 10th December. The second report is done on 20th April. The HbA1c values is 7.4%, and as we tell, the urine sugar started coming present. That means the membranes of the kidney is working great again. The nephropathic changes revert back again. Okay. These data I have taken from my dissertation. I have taken 40 patients of diabetes mellitus during my MD studies, and I have analyzed that the commonest affection during the diabetes mellitus observed. As we are observing in the chart, the moreover patient, there is 17 patient out of 40 are suffering with the GI problems, and 12 patients are suffering with the locomotor system associated with diabetes mellitus. There is the higher relevance of the GI system, digestive system with the diabetes mellitus. So during my study, I have the query regarding this, that why the patients of diabetes mellitus showing so much GI affinities, which answers I have got. In 1837, the next observation of interest was made by a Scotch physician, namely MacGregor of Glasgow, who discovered the saccharine matter in the vomited matter of diabetic patients. From this fact, he was induced to attribute diabetes to faulty digestion. He defined the diabetes as faulty digestion. Dr. Prout had given a similar view, for in his able work on stomach and renal disorders, he said that the facts and observations I have to offer on the subject are founded on the opinion already advanced, namely that diabetes is nothing more or less than a form of dyspepsia. This dyspepsia principally consists in a difficulty of assimilation of saccharine elementary principles, and like all other form of dyspepsia, whether it be an inherited or an induced affection, diabetes is liable to be much modified and aggravated by concomitant circumstances. Okay, as we all know, the diabetes is lifestyle disorder, and also it is metabolic disorder and autoimmune disorder, and it is silent killer. First of all, it has been known as Raj Rog, and there is no treatment for the diabetes. Diabetes means certain death. That was the belief in the ancient terms. But nowadays, with the advancement of the medical science and the advancement of the medical treatments, we got the hypoglycemic agents, also the insulin injections in the conventional methods for treating diabetes mellitus. But in some cases, conventional method also gets failed. When the conventional method gets failed, homeopathy can work individually as well as an adjuvant therapy in cases of diabetes mellitus type 2. Homeopathy can work as both as an individual medicine or as an adjuvant therapy. When the patient is having under any conventional treatment, there is a common question of the patient that if we have to stop the conventional treatment or not. In most of my clinical practice, I have observed that most preferably you should not stop the conventional treatment till the patient is acquainted with your medicine and the glycemic control can be attained same as your medicine like the conventional medicine. Then after you can reduce the doses of conventional medicine fractionally. Okay. Apart from this, I would like to share some data from my dissertation. During my dissertation period, I had attained a literary research under which I have taken the compilation from the various repertories and compiled the rubric of the diabetes mellitus from various repertories under the one section, that is repertory of diabetes mellitus. I have not made the proper repertory, but I have compiled the rubrics of diabetes from the various repertories. First of all, these repertories having the chapters arrangement like that of Kant, that is from mind to generalities, and in every chapter there is a rubric which are having directly diabetes mellitus in the rubric has been taken. So this is the repertory or the compilation which I have made during my MD journey. The first chapter is mind, the second one vertigo, then eyes, specifically the rubric inflammation, retina, retinitis, diabetes in. There is a single remedy, sickle cornutum. Also, I have included the common symptom of the diabetes mellitus, that is in stomach, appetite increase or hunger in general. In kidneys, nephropathy, diabetes in. Weak kidneys, diabetes with. There is a single remedy, phosphorus in it. In chapter urine, as I have discussed during the discussion of the therapeutics, there is two rubrics related with specific gravity, that is specific gravity increased and specific gravity decreased. The specific gravity increased is the rubric for diabetes mellitus, and the specific gravity decrease is the rubric for diabetes insipidus. And these are the all remedies for this. Now, the male genitalia related complications which are associated with diabetes mellitus specifically, and similarly, the female related complication related with diabetes mellitus. As we have discussed, lungs diabetes mellitus in Calcarea force is given as the highest important remedy along with cuprum metallicum. In cases of extremities, as we have discussed, pain, rheumatic, diabetes in, there is a single remedy, lactic acid, which is mentioned in each and every repertory as a single remedy rubric. Also, there is a respiration difficult diabetes in, there is a single remedy, argentum metallicum is being mentioned. Okay, in my compilation, I have made the new chapter complication from compiling it from various repertories already available, but the complication related rubrics I have taken under the separate chapter so that it is easy to refer the literature. That is acidosis or ketoacidosis, diabetes mellitus in. There is a remedy, insulin, natrum phos and senega. Atherosclerosis, cataract, coma, diabetic, congestion, brain cortex of, as we have discussed last, picric acid, and also the lecithin is the remedy for the congestion of the brain cortex along with diabetes mellitus. And there is the last chapter, generalities. In generalities, in these all sub-rubrics, there is a various elements from of diabetes mellitus is given in various repertories. That is synthesis repertory, complete repertory, and Murphy repertory. Also in the Borix repertory, that is diabetes liver complaints in diabetes hereditary. Carcinosin is giving highest importance. Diabetes lung complaints in calcarea force again. Diabetes obese in diabetes rheumatic pain with diabetes of gastrohepatic origin, liver complaints from, stomach complaints from. Uranium nitricum has been given, as we have discussed, it is for hepatogenic diabetes, liver complaints from. So thank you so much. This is all about my.
Thank you very much. What a wonderful presentation you have given from the beginning to the end. How much time, how much days you have spent to prepare this preparation, and you have given it as a juice for us, because it is very easy for us to drink the juice. You have given the contents, and really, really appreciating you for the work from the beginning to end. You have given, actually it is overloaded for us. You have given such a such a huge knowledge to us. Thank you so much. I don't know how to appreciate you for this. Thank you very much. And anyone else in the presentation, those who have missed this presentation, this is it's their bad luck. anyone
Uh,
anyone
uh,
okay, Danish. Dr. Danish, please.
Yes, thank you, Dr. Parthadu. It's really an amazing session indeed. You, it was just like a 2020 game with the all sort of swords. One day, as we say, it was full of sixes, boundaries, even bouncers, and everything was there. Just like when you watch a 2020 game. Because diabetes mellitus is a big subject. We need hours and hours for understanding and studying. And the most important aspect is the idea of homeopathic materia medica in diabetes. That also required days and days or weeks and weeks to
yes.
understand. But you showed everything in a nutshell with its beauty, and that's what we have said in this session. Diabetes, management of diabetic mellitus type 2 is entirely different from managing all other diseases because whatever be a profession, whether it be homeopathic, allopathic, Ayurvedic, whatever may be, only management can be done. No,
Yes.
no, but of course there are some cures also in between that happens. If the patient come to a homeopath at the beginning stage, we can manage, not only manage, we can even cure. But the thing is that people never identify that it is a case of diabetes. But when something happens, for example, when most of the um, people from gens, when they get some urinary infection, or sometimes they may get little bit of phimosis or balanitis, then only they used to check the blood and find that, oh, it is a very high diabetic is there. And because of that, then only realize that, oh, I am a diabetic patient. That's the reason why it is not healing. Sometimes they may be mistaken, or sometimes some other problem may be the reason. Anyway, congratulations. Hope you can come up with some more presentation. We are all waiting for that because this kind of one-day cricket is a must for homeopathy.
Thank you so
Thank you.
much, sir.
Thank you, Dr. Danish. And now Dr. Ram Parvesha sir want to say something. Sir, you can unmute yourself and please.
Thank you, Ajini. And Namaskar, Dr. Dhanesh. Congratulations, Dr. Parth Dave. Very nice. Lot of medicine. Describe the lot of medicine according to the repertory and cause diabetes. Manage of diabetes mellitus. So only you have only one medicine Nigella sativa.
Okay.
Nigella sativa is a very good remedy. क्यों? उसको हिंदी में बोला जाता है मंगरैला, है ना? तो नेगेला सटाइवा इज अ वेरी गुड पेन ड्रॉप 3 times daily manage of diabetes and a lot of medicine सेडिजियम यूरेनियम नाइट्रिकम जो है तो मंगरेल जो है नेगेला सटाइवा इज अ वेरी गुड रेमेडी. तो वेरी वेरी थैंक्स डॉक्टर
Thank you so much, sir.
पार्थ दवे
Thank you, Dr.
again
Ram
for the
Parveshwar sir,
invitation.
and thank you, Dr. Partdev. And
Thank
I have a request: when you are taking the class for the next time, you can divide it into
Yes.
3 classes, and we
हाँ.
can. We can
चलिए घर होम्योपैथी, घर होम्योपैथी.
the homeopathic medicine itself we can take for 1 hour, so it will be more helpful for the audience and doctors also. So thank you so much, and appreciating you from the bottom of my heart, and thanks for coming and expecting your classes in the future. Thank you. And now we are moving to the Malayalam session, and all the participants, thank you. Next time, tomorrow we'll see the same time. Good night. And now I am inviting Dr. Mariamma John for moderating Malayalam session. Dr. Mariamma John, you are welcome, please.